So, what is ADHD? ADHD is a chronic neurodevelopmental condition that involves attention difficulty, hyperactivity, and impulsivity. So, roughly 85% of people with Tourette syndrome have ADHD, and that's like actually a huge number. So, most people you meet with Tourette syndrome have a diagnosis of ADHD or display ADHD symptoms. Next, okay, when does it start? So, ADHD symptoms typically appear around the ages of 6 or 7 years old, but it can start earlier or later depending on how noticeable or debilitating it can become. So, for me, I always had symptoms. My parents said, my teachers was like, dude, you should get auto checked out for ADHD. I didn't really get diagnosed until my early teens. So that's when when schoolwork started to get like debilitating and I couldn't focus and stuff. But yeah. What are some of the symptoms? So there's a lot of symptoms that can go with ADHD, way more than on this list, but here are the few that are the most common. So being unable to concentrate on tasks, finding it difficult to sit still most of the time, excessive talking, difficulty with taking turns, acting without thinking, interrupting conversations, having a short attention span and being easily distracted. And when I say having a short attention span, meaning like you're working on something and maybe you'll be distracted by maybe a loud noise or maybe a thought that isn't like the same as what you're trying to think about. And people with ADHD actually have an incredibly capable ability called hyperfocus. When they're very interested, they can be focused on something for 5 hours on end and not get up or be restless. Like, it's insane. So that's the positive side of it. And then they can make careless mistakes, whether this be in schoolwork, maybe in daily tasks, having difficulty being organized. That can be in school, in your environment. For me, I have a hella messy room. You guys just can't see it. Having also in school, I'd always lose my papers and I'd always forget assignments and stuff. So organization is a big part in that. And then also appearing to be in their own world or daydreaming. This is often in girls a lot of the times. Girls with ADHD often are in a daydream and are often called lazy and dumb, but really that's not the case. And people with ADHD have very creative abilities. They can think outside the box. Like, it can be awesome. How is it diagnosed? So ADHD is diagnosed by using the DSM-5, which is just like otherwise known as a diagnostic statistical manual, a big book of like disorders and stuff that doctors have created. So the doctor will go through your medical history. Your parents will be asked to fill out forms, ask you lots of questions, and you'll get a chance to fill out forms too. And if you're a student, they will have your teachers fill out forms about what symptoms you are displaying in class. So, yep. Next slide. Quick facts. So boys are 4 more times more likely to have ADHD. ADHD can be caused by genetics. If you have a parent with ADHD, that's probably why you have ADHD. It's 50% of the chance. If I would have a child, they'd most likely have ADHD. Low birth weight, high lead levels in early childhood. So like different toxins can actually physically change your brain, causing you to have ADHD. And if your mother smoked or drunk when you were in the womb, that can also lead to ADHD. It's also very common, affecting 1 in 5 people in the world. So most likely, if you probably have met so many people with ADHD and not know it, or maybe you have, because sometimes it's super obvious when a person displays traits. So ADD is the same disorder as ADHD. It's just that ADD does not involve hyperactivity. People often get confused about that, but it's just that ADD has basically all symptoms except hyperactivity. And then ADHD is a lifelong condition. Doctors say you grow out of it, but that's not true. You're diagnosed with it at a young child, or you can be diagnosed with it at in adulthood, and it's very debilitating. The only thing doctors say you'll grow out of it is that you'll manage your symptoms better and stuff. Treatment. So medication is highly used in treating ADHD. Most patients diagnosed will choose to take medications such as Ritalin, Adderall, or Vyvanse. Here's the problem, though. A lot of these medications listed are not good with Tourette syndrome, so you will probably have to take a non-stimulant medication, meaning that it doesn't affect your brain or whatever, or something. I don't know. Those medications are not good with Tourette's. I was on Ritalin. My tics got super bad at sometimes, and it actually helped others, but I wouldn't recommend that. ADHD can also be helped managed through different therapies, such as cognitive behavioral therapy. So like training your brain, maybe to, when you can't focus on a certain task, maybe finding different tips that can help you complete it. Applied behavior analysis, same thing, sort of. You're applying different techniques to help you with your attention or improve your attention. And then counseling, psychology, and support groups, because we all know that it can be very lonely if you experience something and you don't have anybody to talk to, maybe your family doesn't understand you, so support groups are very helpful. Same with therapy. Don't be afraid to ask for help, guys. Help can be amazing. Also, ADHD can also be treated using different lifestyle techniques, such as going on a strict diet, following daily routines and schedules, and making changes to the environment at home, school, or workplace to help manage ADHD symptoms. So basically, for me, I try to stay away from preservatives, food dyes, like excess sugar, especially during school, because I know that will make me have an increase in hyperactivity, and I won't be able to focus as much if I'm on that. And also, following daily routines and schedules is very important if you have ADHD, because our brains are so like let's say, what's the right word for it? Maybe let's see, they're very jumpy, and so if we don't have a routine, we can get easily lost, and we won't be able to do simple tasks such as like hygiene, maybe eating lunch, maybe remembering deadlines. So daily routines and visual schedules are very helpful for that, and making changes in the environment, meaning accommodations and stuff at school. Okay, so what to do if you think you have ADHD? Lots of people these days think they have ADHD, but it's also important to note that ADHD takes a long time to actually diagnose, because you have to meet certain criteria. But if you think you have ADHD, you should talk to your parents and explain them your symptoms, maybe what you experience, why you think you have it, and then schedule a doctor's appointment and go over that with your doctor. Keep a notebook and keep track of your symptoms and how they affect your life. Talk to a counselor at school, whether that be high school counselor. In college, I know you can go and get counseling help, and then schedule a psychologist appointment and ask for a full assessment. This can be really helpful because maybe it might not be ADHD, maybe it might be a different condition that you're actually experiencing, but maybe you have more than one condition, because with ADHD, if you have ADHD, you're more likely to have another condition such as a learning difference or something. And then try using different things to alleviate your symptoms and see if that improves them.